All right, guys, welcome back. This is Cody Fairfield, editor-in-chief of the Libertarian Republic. Today I've got a great guest with me. It's Dr. Josh. He's with AtlasMD, a specialist direct primary care physician out of, I believe, Wichita, Kansas. Is that correct, Josh?
Correct.
How about you tell us a little bit about yourself, Josh, and what your entity does?
Yeah. Well, I'm born and raised in Kansas. We bleed purple for K-State Wildcats there, and we started our practice 7 years ago almost with just an idea that there had to be a better way for healthcare. Growing up, my dad ran a business and it worked well. It ran smooth, so I knew kind of what to expect in that environment. And then when I got into medicine as a pre-med student, you could see that it was just a cluster and it was overworked and overregulated, too much paperwork. No one really knew what was going on, and so we really felt there had to be a better way. And over the next 10 years, I watched a lot of different models of insurance-free or membership or high cost versus low cost. And when we started in 2010, we tried to bring the best of all those pieces together to have what we have now.
That's very exciting stuff because I mean, as you're well aware, the insurance today, or insurance in healthcare specifically, is a giant debacle. It's a big mess,
But
and nobody seems to really have any answers to it. But it seems like you guys have kind of found an answer in I would consider you guys still probably a small business, but your ideas are growing and you guys are doing really really well. And everything I've read, that your clients love your product. So let's dig into that exactly. I'm reading that you guys are cash only, and you guys are specialized, meaning you're slightly different than other direct primary care offices. Do you want to explain a little bit about that?
yeah, our specialty is family medicine, and again, insurance free, and a monthly membership, really just like a gym. And it is, it's a small business, but I think sometimes the best ideas are the simplest ideas, and we're trying to reinvent that healthcare industry, almost Apple-esque, if I can be so bold, of design by subtraction. What is the fewest number of moving parts we can do to have the best possible system? And the insurance debacle of a system is because we overfit the algorithm. We tried to get insurance to cover every scenario, every possible medicine or this or that. What it really created was a lot of unnecessary paperwork for the basic regular stuff. So in our model, kids pay $10 per month. Most young adults are $50 per month for unlimited home visits, work visits, office visits. We do technology visits that most insurance doctors won't do. So phone call, text messaging, email, social media, video chat. Another thing we did was eliminate pain points for patients, friction points. We have no copays for anything, and any procedure we do in the office is free. But that's because they're shockingly cheap to provide. So something like stitches that'd be $1,500 at the ER, we do for free because it costs us $1. A strep throat test is $1. A urine dipstick for a urine infection is 10 cents. If we did an EKG, it's 36 cents, and that could cost you $200 at the hospital. The coffee in the waiting room is 60 cents a cup. Uh, I should be submitting insurance reimbursements for the coffee, not for the EKG. And that doesn't obviously make any sense.
Right.
And that's because we're not anti-insurance. We're kind of quick to make that distinction. Insurance is great. Home insurance, life insurance, car insurance, all valuable products when structured correctly. This is not that insurance for healthcare is bad. It's just overgrown. It's misused. Wrong
It,
tool for the
it's
wrong job.
bureaucratic.
Yeah,
Right,
absolutely.
and that I mean, one recent incident that kind of proves this, and it's more, I guess, regulation than bureaucracy, but those two things act upon the market the same way. Would be the EpiPen epidemic, that where it costs 3 cents for the actual epinephrine that's inside the pen, but the pill or the entire apparatus itself costs you
Six.
$600.
Yeah, exactly.
It's unbelievable. So I think your guys' model is wonderful, especially because I mean, from what it sounds like, and correct me if I'm wrong, I could walk into your office and be like, Dr. Josh, I cut my knee open, I need some stitches. What's that going to cost me? And it sounds like you can give me an upfront approach saying, hey, this is what it's going to cost you, out the door, no questions asked, this is what it is, and I can understand that.
Just like any other business, I would expect a web designer, a software designer, a lawn care guy, a Xerox, any other store I go to, there's a price. and good, better, best models and customer service. Zappos being the pinnacle of great customer service to sell a great product, and in healthcare, they don't even need to know your name. They don't even have to be nice to you because they have so many other patients, and they're drowning in paperwork. They're burnt out. The customer's not getting a good product. It's kind of silly that people even continue to allow that.
Right.
You'd think they would break out of that system sooner than they did.
Absolutely, and so the one thing that comes to my mind as we're discussing this is obviously under current law, which would be Obamacare still, even with the creation of the House GOP, but we'll get into that later. Under Obamacare, obviously there's a mandate stating, and this is obviously ignoring the executive order that was just passed, but there was the mandate where you had to have insurance or you face a penalty. Will you discuss how you guys get around that, and for your members, what benefits that reaps them?
This penalty for not getting insurance, it's bad government, among all else, because we knew it didn't seem right, and then you're penalized if you don't buy something. That seemed wrong, but a lot of our patients were choosing to just go uninsured because it was $1,200-$1,300 a month for their health insurance, which was close to or greater than their mortgage. That makes no sense. But then they're fearful of an IRS audit or penalty or something, and then for the government, thankfully in some ways, regrettably in others, to come out and say, "Oh, that thing, yeah, we know we told you we were going to really force you to buy health insurance at $1,200, $1,300, $1,400 a month for a year, but now, nope, that law is not going to be enforced anymore." Good. I don't want the law to be enforced, but it shouldn't have been there in the first place because that caused true economic harm to families who would have done anything else with those dollars, or employers who would have hired more people or made more product, provided more service if it wasn't for that ridiculous cost factor. So, but probably the biggest way that patients avoid going through expensive insurance, whether it's the Affordable Care Act or any other alternative, is their employer. With the employer and the partially self-funded model, we have what is as close to our ideal scenarios as we could ask for.
So to clarify, you guys essentially work with employers to make sure that these people aren't penalized for not carrying typical insurance.
Right.
Okay.
At least in a self-funded model, even if it's not an ACA plan, it's ACA compliant enough to avoid the penalty.
Gotcha. And that's fantastic because that one alone gives consumers another choice of what to do with their healthcare. And ultimately, that's the biggest issue, is that there isn't very much choice because, one, it's a tough industry to discern on your own, and two, with the government involved, typically you're forced to do what they would like you to do.
Sure.
So I just want to run through a recap of what you guys offer, and then we'll actually step into the bigger picture of comparing Obamacare versus the House GOP's plan, which has been termed the American Health Care Act. And that way we can have a nice contrast between who you are, what your entity does, versus what the current status is, the GOP's plan, and then we can have a discussion about how we create something that is a better healthcare world for your model.
Okay.
All right, so I'm going to go down a list of what you guys offer. You have unlimited access to your doctor, 24/7, is that correct?
Correct.
That's amazing. I can't get a hold of my doctor in 20 minutes if I needed him, and I've got you on the phone right now. I might have a checkup after this. I don't know. Extended visits, so you guys are not rushed to schedule. You guys don't double schedule like a lot of doctors do.
That's correct. Our minimum appointment time is 30 minutes, but if a patient needs an hour, it's no problem to schedule for that. The average doctor sees 30, 40, 50 patients a day. We see 5 or 6 a day in the office.
And that gives you so much more intimacy to get to know your clients and allow them to have the best service they could possibly have. Am I correct to understand you also do same day and next day service?
Oh, yeah. I'd say 95+% of our patients are seen the day they want to be seen.
And it's funny that that's actually a weird contrast, because you would think, hey, I cut my finger today, I need to see my doctor today. The only way to go do that is through the ER currently. So through you, I mean, that's an amazing service in and of itself.
My partner had to come in just the other night for a patient who cut themselves and shoot, again, stitches that would be easily $1,500 in the emergency room are free with this membership model. So people say all the time, well, it's hard to shop for good healthcare. Well, yeah, it's hard to shop for lots of products, and I buy those in advance. I pre-shop for them before I need them. So this model is not too different. And if you can spend 50 to avoid 1,500, that's a pretty good value.
Yeah, absolutely. You guys do an annual physical for free.
Hmm.
You offer diagnostic and procedural benefits at no extra cost.
Correct.
And let's talk about obviously this makes you completely transparent because the consumer knows what they're getting the day they walk in. But the last thing I really want to hit on is that the price of medication and why you guys are able to keep that so low.
Yeah, this was a great breakthrough for us. I think the best thing a doctor can do is uh, be proud of running a business, innovative, and what that means for their patient. We take an oath of do no harm, and I increasingly think that that should mean do no financial harm to our patients. Every good business creates value. I've got supercomputer in my phone because of good business. So we kept plugging away for a solution for our patients to have more affordable medications, and we found it in kind of an odd law that's been around for forever. Um, Doctors can dispense their own medications to their patients, and this is true in 44 states, which doctors on some level have always done. They did that with their flu shots and lots of basic things. They just never took it to the next level of getting all the meds for the patient. So a migraine medicine that would be $100 at the pharmacy, we get for $5 wholesale. It's kind of ridiculous, and it's just that easy. We use one website. It's
That's
Amazon.
monumental.
Yeah, it is. Elon Musk can send a payload to the space station for 95% less than NASA because of good business. Hell, we have a private space race. I mean, who would have thought those words would have ever from two giant corporations? Yeah, says the
Yeah,
libertarians. Huh? Yeah, and so if we can do that, we can fix healthcare. And this idea that no one was out there actively pushing the price down, the Walmart's, Targets, CVS's, and because they didn't, that opportunity for savings was always sitting there. For us to just go in with no change in law, no change in regulation, no change in licensure, it was there. If I was a patient, I'd be mad at my doctor.
yeah,
Honestly, how many years of, and what economic impact did that have on the poorest and the sickest of our patients when they're spending $30 a month for their heartburn medicine and I get 1,000 pills for $30.
right.
Uh,
So you didn't reinvent the wheel at all. You just took the wheel and made it roll.
Used it.
Yeah,
It's a tool, and instead of just letting it sit there, we said, "Let's go."
that's
Uh,
amazing.
and we
I
can
mean,
apply that to medicines, labs, radiology, pathology, specialty consults. Cash is king, and
yeah,
we know healthcare is bloated. No one disagrees with that. Well, then, if it is bloated, and we can go in and remove the bloat, what is the true cost of care? This is a paradigm shift that is worth talking about because in one world, based on our experience and evidence, we say healthcare is expensive. We need insurance for that. So we had a patient before they joined. They went to the lab and got $1,026 worth of lab tests done, and we showed them what our cost would be. It would have been $39, 97%
wow.
less. So, and then if you take that information, that changes your reality and says, well, if lab tests only cost $37 a tank of gas, why would I ever have insurance? Why would I spend $300 more per month to have lab insurance when once a year when I need labs, it's not $40.
Right.
We did a ton of stuff in that scenario that wouldn't have been the normal routine things. Our normal yearly labs, $15 or $20. In one world where your migraine medicine is several $100s a month, you need insurance, and when it's $4, $5, $6 a month, you don't. We've even got breast cancer chemotherapy for our patients for 99% less, from name brand retail to generic wholesale.
You guys are
Why?
literally saving lives by saving money. That's
From a
that's the
booth.
most amazing part.
Yeah, saving lives from saving. I'm stealing that, and I'm going to make it. I'm going to tell everybody I thought of it myself.
You got it. I will let you take the credit from that. As long as you guys keep doing what you're doing, I will absolutely let you take credit for that. I mean, one last question that I kind of thought of as you were kind of running through this, because I'm sitting here going, "Oh my god, I need that! Oh my god, I need that!" Because I can tell you, as a millennial who just came off my parents' insurance, I had that internal battle. It's like, well, what do I do? I mean, I don't need. I work out regularly. I eat pretty well. I do the things I need to do to take care of myself. That is
You have a
self.
great beard.
Oh yeah, I grew it myself. Thank you. Uh, yours is pretty fantastic as well. I've got to catch up. But yeah, I do all these things to preempt any kind of condition that I can do on my own without having to use healthcare. And typically, I don't see the doctor that often. I don't need to. Obviously, I do my annual physical and I do my checkups. But why do I need to pay? I think my premium was asking like $325 a month for me through Obamacare, and I was just like, well, okay, well, if you take the percentage of my salary, that's going to be the fine, or I think it's like $695 is the minimum, something like that. Why? What's the point? If that's my one upfront cost for my doctor's visit a year, what's the point? So my question is, do you guys how then does somebody who isn't in Kansas or isn't near you, can they use your service, or is it dependent upon this model growing further?
Well, the nice part is we have several hundred doctors around the country doing this model. Again, we started between a little over 230 practices doing this direct thing ourselves, all independently owned and operated. But there's maybe between 500 and 1,000 doctors doing this model across the country, and every patient should ask themselves what you just said is for any product. Do I use it? Do I need it? Is it worth it? And at a young age, you should be able to get health insurance for $50, $75, $100 a month that covers the big stuff: car wreck, cancer, heart attack. But I pose this question to patients all the time, med students. They all often think that mandate was good, that was an appropriate use of government powers. And so, okay, well, who in here has life insurance? And your average 25-year-old med student never thought of life insurance. They don't need it. Why would I spend extra money on it? For when someone else dies. Okay, so if it's not okay to force you to buy life insurance, why is it okay to force you to buy health insurance? And they start to kind of pick that apart. I would say I wouldn't even expect every millennial to buy our services. If you don't go to the doctor much, if you don't find the value in that, have meds, need labs, that's fine. You may do just as good at a urgent care for $150 once a year because you only used it once a year. So this is really a Netflix to Blockbuster type model where people will choose the value that they find most beneficial for their lives. However, the net effect to the system is if we lower the cost of all healthcare by 30 to 60%, then even more people will see that, well, at $500 I don't want insurance, $400 I don't, but $300, $200, $150 I start to see the value. So if we really do want to insure more people, we have to make it affordable.
Right. Yeah.
And the other, yeah.
It doesn't do anybody any good to run them out of house and home just to provide them health insurance, especially those people who don't need it.
Yes.
And that's like you were saying, is the way our current system is dependent upon. Well, let's kind of get into that. Let's talk about Obamacare versus Obamacare Light, or 2.0 as it's being called, with the House GOP plan pushed by House Speaker Paul Ryan, backed by the President of the United States, Donald Trump. Their CBO report just came out the other day, and I don't have the exacts, but I believe it was somewhere near 25 million are going to be uninsured by 2028. I don't have that exact number, and I'll correct that when we write the article up. But it was into the 20 millions will be uninsured by the mid 2020s through the American Health Care Act. On top of that, they have opened the door for Medicare expansion through 2020, which is something, one, that the Republicans said they wouldn't do. But, they will wean, I guess, the nation off of Medicare expansion. They did talk about an age-based tax credit, which is also kind of confusing because, in my mind, you're saying, here's a tax credit, take some of somebody else's money to offset your cost for insurance.
Yes.
Which is also strange, and that tax credit is for a single person, $75,000, who makes an income of $75,000. They get the tax credit, and any joint account that is $150,000 or less. It still covers pre-existing conditions, which is one of the most expensive parts of the ACA or Obamacare. Correct?
Right.
And they still have a penalty for not being insured. Which is also kind of funny because they're like, oh, we're not going to charge you money for not having health insurance except this 30% premium penalty that you pay for 1 year should you be uninsured for more than 63 days. Right. So let's get into that a little bit. Do you see the Obamacare versus I guess we'll call it the American Healthcare Act, just to kind of make a distinction. Um,
Sure.
what do you see as the biggest differences between the two, and is it that big of a change from one to the other?
Unfortunately, I don't think it is a big change. I think the Republicans are guilty of the sin of unoriginality. This is the same thing packaged up slightly different. They haven't added fundamental change to this, and I think because they aren't doctors. Even if they went and talked to the doctors, most doctors aren't doing this model, so most aren't familiar enough with this to propose it as an actual solution. So, thanks to this show and others like it, helping that snowball to grow momentum in public opinion. But I was speaking with the Mississippi governor today, and he's the first one I've heard actually elegantly describe the problem. We are not talking about healthcare costs. And insurance is a payment model. That's all it can ever be. So if we're going to be paying for something, let's at least have a conversation about what it actually costs. And they're going to be uninsured. Well, what's that mean? Insurance isn't healthcare. If some people would be better suited not having health insurance, just like they don't have life insurance, for some portion of their time, depending on finances. But if the cost of health insurance, for insurance sake, is driving the job force market participation down, that's not a good thing. But we can have a conversation that says, well, 80% of what health insurance is paying for, we can make affordable. So take that off the table. So if all you were paying for is what's 20% left of healthcare, then I bet you 20 of the 25 million would go ahead and buy it, or could have it purchased for them through the state federal services, because now those dollars go so much further.
Right.
We really feel that this is a bipartisan issue or solution. If I can get a test the state is paying $50 for the blood test, and I get it for $1.65, great. The state should embrace this kind of libertarian free market approach. Even if you are a Bernie Sanders liberal, you should say that's wonderful. That's the market forces driving costs down. So if we leave our Medicaid budget here, it's 25 times more valuable because we can buy that much more purchasing.
Correct. Well, capitalism being evil, it's hard I guess, for most of them to kind of see that, right? And
Right.
that's the biggest issue, is they don't believe in market forces, and that market forces innately will drive prices down based on the needs and demand of consumer goods.
Yeah.
I think it's literally amazing to me to hear that, because most people's argument with single payer or universal healthcare is that, well, like you've said, the healthcare cost is too expensive. But you've actually got a direct model that shows that the government actually cannot possibly make it more affordable than you.
Yeah. To step out of the way, if I get 1,000 pills of blood pressure medicine for $8, 0.8 cents a pill, and we mark everything up 10%, so we're very transparent about that. Now it's 0.88 cents a pill. There's literally nothing the government can do to make that
You
cheap.
greedy capitalist.
Greedy damn capitalist, yeah, dirty dog. But that's a loss leader of sorts. I don't have to market. Patients love the fact that their meds are cheap, and they tell people. Amazon loses $100 million a year on diapers to make profit up on other diaper-related products. Amazon should be doing wholesale meds. Amazon, as a capitalist American, we expect the major players in the game to outcompete each other and to drive forces down and drive value up. Amazon should be doing, and I email Jeff at Bezos.com once a week to try to get them to do this. They should be delivering medicines for free. At a penny a pill, they could afford to do so. They could do it by drone, because that's the age we're living in.
Mm-hmm.
And they could do it as part of your Prime membership, just to outcompete the other big box stores who haven't done it. And if I was a Walmart customer for 20 years buying my migraine medicine that I desperately needed to stay employed and happy and healthy, to find out that Walmart was upcharging me $100 too much for that medicine, I would have a serious trust problem with Walmart. I wouldn't go back there. So there, I understand why the left would argue that there's not market forces in healthcare, because they haven't seen it work well. But that's just a matter of time, and it's working well now.
Right.
We can show examples of that, and what the enormous economic impact of that would be at the full scale.
So, looking at the plans that have been proposed, they're both, well, the current one, Obamacare, the American Health Care Act, the GOP leadership's plan, and then you have this third one that's been floating around that seems to get awfully ignored by both the president and others, which would be Rand Paul's, plan, where he emphasizes the healthcare savings accounts. How do you see his plan in comparison to Obamacare? Is it a better step closer to what you would like, or is it somewhere still kind of in that weird, wishy gray area of government overreach into people's doctor-patient relationship?
I think it's still in that gray, overreaching area, in part because as much as I'm the biggest HSA fan there is, because it's people getting their own money back to make decisions with, but the PR problem that the Republicans are going to have in this issue is it's the modern equivalent of let them eat cake. The $6,000 pre-tax account that you can have that you don't have enough money to fund now, we're going to improve to $9,000 or $12,000 of money that you can't afford. Never mind, we never actually fixed the cost of care. We never even talked about it, never thought about it, never looked at it. So the migraine medicine, that's $100 too much. You can't save any money in your HSA at any level, right, if you're spending it all on healthcare and health insurance in the front part. So they need to say, true HSA reform is make the value of those dollars mean something. And we're driving down the cost of medicine, of labs, of imaging, of everything that you're using, so that you don't even use your HSA dollars. Let those grow over and over and over so that you have money to retire with, not just to waste inefficiently and yet a still broken system.
Yeah, I think my next venture here is going to be to try to get you to talk to Rand Paul, to talk to Bezos. What we're going to do is we're going to make our own. We're going to create our own version of Amazon Prime, and it's going to include the free shipping. Right, they're free 2-day shipping. It's going to have Rand Paul introducing the bill on the House floor, or on the Senate floor, and then he's going to have the House Freedom Caucus put it up on the House floor, and that way we get direct primary care access through the American healthcare system. We have free shipping on Amazon, and both you and Bezos are able to make money.
And if you could somehow weave Elon Musk in there, I will die a happy man.
We're going to fly you to Mars. You're going to inhabit the first planetary, the first human life on Mars.
First direct care doctor on Mars.
There you go. And we'll do it with 2-day shipping. You will be shipped in 2 days.
2 days.
It's possible. It is possible. Look at that. Yes. We're innovating right here on a live podcast stream. Things are amazing. You can't doubt technology.
We're living in the future.
Exactly. So let's expand on this idea then. Obviously, the healthcare system's broken. The two plans that have been introduced that are ready to be voted on are crap. Rand Paul's a little bit less crap in terms of his healthcare plan. I think he's a pretty damn good senator. But let's talk about what the next step is for you. What do you need? What can people that listen to, like I told you, we reach 1 to 2 million people a month. What can they do to help you get your healthcare model into the United States healthcare system? Broad spectrum.
This is, has been, and I think always will be, a grassroots movement. We started out by putting our patients first and building a better mousetrap for them. They loved it. It grew because we had a great why. I love that TED Talk, Start With Why. And we have the best version of that is our patients. When it was good for them, they told their friends, their family, their employers. Now it's growing at a level where they can tell their other doctors they know that this is a model that patients want. We couldn't even keep up with the social media. We had our med student answering phones just to answer the questions coming in. Our first DPC intern, Cooper, was wonderful, and because the volume of patients coming and saying, is this in my area? I need this. What would my meds cost? Oh my goodness, this is a godsend. So we need that outpouring of grassroots support. Who then talk to their senators, talk to their governors, talk to their legislators. Use the social media to their fullest, because I think the problem that the legislators have is it's hard to penetrate that veil of DC. Good ideas, bad ideas. There's so much conversation that it's getting lost. But as they hear it, they say, yeah, we kind of already got the back of our hand slapped for these 3 not so great plans. This is not drain the swamp. This is not fix it. This is not repeal and replace. This is just not new. And patient, confident as the voters are in their president, they want a solution, and this isn't the solution they were promised. So when they see that, I think they're not against this idea. They just haven't heard it. They haven't seen the potential. It sounds like the governor of Mississippi it might be leading that charge. We're getting other media personalities who are seeing this and talking about it and making it important. So hopefully, with strong grassroots demand, they'll get direct care doctors to DC to kind of help further along the conversation.
That sounds like my type of campaign. The people actually working in their own self-interest is the best kind of message to put out there. I can tell you that if I ever run for office, I'm definitely going to be giving you a call, and you're going to structure my healthcare plan for whatever office it may be. I don't care if it's city council.
Yep.
Because
drones, Elon Musk, yeah, we'll get you. Yeah.
Exactly. We're going to have the first interplanetary healthcare system.
How can you
that allows the individual to make decisions between them and their doctor. And ultimately, that's really what we're going for, is we want people to be able to make the decision of what they need, when they need healthcare, if they buy healthcare in the first place. We want them to be able to decide on the drugs that they're using, and understand innately how much it's going to cost them, and not have to go into a surgery room and come out going, oh, well, you said it was 10 grand, but now it's 16 grand because
right.
you did something incorrectly. I think what you're doing is amazing, Josh. I cannot tell you how much I appreciate your message, your clarity, and your understanding for free markets, beyond what you do for you as a doctor, which is amazing and life-saving all in itself. So I want to thank you for being with me. I'll give you a second if you want to talk about where people can find more information on you, where they can reach you if they want to bring you on your show, because I want to give you that spotlight so that way your message gets out there even more. Whatever else you feel like you want to add in here, let's take some time to do that right now.
The best way to reach us is hello@atlas.md, or Twitter or Facebook, both are the same, atlas.md. But the best website to go to find doctors in your area is dpcfrontier.com, or the next one is iamdirectcare.com. But you can message us. We'll help you find a doctor in your area. We have a podcast on iTunes, AtlasMD. We have YouTube videos. We have a blog. We have information out there galore, free for physicians who want to do this model so they can get started. We are passionate about growing this movement. And as people have questions, we want to connect them with doctors. We want to help more doctors do this. But those websites to find the doctors in our area would be the first place to start.
That's great, Josh. Well, thank you again for being here. I would love to have you back sometime and continue to keep in touch so that way we know what's going on with you. And hopefully one day we see you on Mars with your first X Primary Care's health center. And
hashtag Elon Musk. Yeah,
exactly. Elon Musk and Jeff Bezos being your first customers.
Those are good
on Mars.
Right? Yeah. Yeah.
All right. Well, thank you, Josh.